Hey everyone, I'm Patrick. I'm an infectious disease specialist from Washington University, as was just mentioned. Sorry for those of you who have to, listen to me chat again. I've done a number of these, but this is actually the first time that I've been invited back, so much appreciated for that. I sort of split my time seeing patients in the hospital, so the sickest of the sick, people don't know what's going on. If they think there's an infection, I get called to sort of help figure out what's going on and how best to treat folks. So I usually start with a couple things like the elephant in the room, and these are like the biggest sort of concerns about the vaccines. And so I start off with what they are. So I think probably by and large, the biggest sort of misconception about vaccines is that vaccines prevent you from getting an infection. That's not true, okay? We would like to think that that's the case, but truth be told, if you are exposed to the flu virus, right? You're gonna have someone accidentally sneeze or cough in your face during flu season. That virus is going to be able to sort of get into your mouth, your nose, and sort of start replicating there within those tissues. But what the flu vaccine tries to do is it tries to teach your immune system that when it recognizes that virus, that it is going to mount its response faster. And then really its ultimate goal is to prevent you from getting real sick, okay? So you can still get an infection, and I'm sure that people have heard in the news about breakthrough infections and the number of people who are fully vaccinated getting infections. People will still get infected. What we're trying to do, again, train the immune system to respond faster, stronger, to keep you from getting to be the person that's intubated on the ventilator machine in the ICU. If you come down with the sniffles, I'm sorry that that happened to you. But again, if that's all that it is, that's much better, than potentially being really sick, being hospitalized, being in the ICU. So that's really sort of the goal of the vaccine. So again, we will see numbers. People will have breakthrough infections. That's sort of the name of the game. And so whether that's the COVID vaccine, the flu vaccine, measles, mumps, rubella, we've been working on this whole vaccine thing for over a century.